पढ़ने वाले हैं इलेक्ट्रोकार्डियोग्राम, sinus rhythm, waveforms and intervals. ECG is the recording of sequential sums of depolarization and repolarization of all myocardial cells. The electrical depolarization of myocardial tissue produces a small dipole current. It can be detected by electrode pairs on the body surface. These signals are amplified and either printed on special graph paper or displayed on a monitor. Depolarization is the sudden change within myocardium during which it undergoes a dramatic electrical change. Entire myocardium is depolarized in a coordinated manner. P wave. The ECG waveforms are labeled alphabetically beginning with the P wave represent atrial depolarization. The SA node triggers atrial depolarization producing a beginning P wave. QRS complex depolarization slowly spreads through the AV node which produces a depolarization wave which is too small to be detected from the body surface. The bundle branches and Purkinje systems are then activated, initiating ventricular myocardial depolarization. During this, QRS complex is produced that represents the duration of ventricular depolarization because of the larger size of the ventricular muscle mass than that of the atria. The QRS complex is larger than the P wave. Normal value is 100 to 110 milliseconds or less. The QRS complex is subdivided into specific deflections or waves. Q wave. If the initial QRS depletion in a particular lead is negative, it is termed a Q wave, indicates septal depolarization. R wave, the first positive deflection, is termed an R wave. S wave, a negative deflection after an R wave, is an S wave. Subsequent positive or negative waves are termed R, R prime and S, S prime respectively. Lowercase letters QRS are used for waves of relatively small amplitude, and entirely negative QRS complex is termed as a QS wave. PR interval. It is the interval between the onset of P wave and the onset of QRS complex. Normal value is 120 to 200 milliseconds. It largely reflects the duration of AV nodal conduction between the atrial and ventricular depolarization. Repolarization is the restoration of electrical polarity of the myocardial cells. Repolarization is a slower process and spreads from the epicardium to the endocardium. Atrial repolarization does not produce a detectable signal, whereas ventricular repolarization produces the T wave. However, atrial repolarization may become apparent in conditions such as acute pericarditis and atrial infarction. QT interval, it represents the total duration of both ventricular depolarization and repolarization. It varies inversely with the heart rate. ST-TU complex, it consists of ST segment, T wave and U wave, and is due to ventricular repolarization. The J point represents the junction between the end of QRS complex and the beginning of ST segment. U wave, small rounded upright wave following the T wave, most easily seen with a slow heart rate, indicates repolarization of Purkinje fiber. फिर उसके बाद ECG leads. The standard 12 lead ECG records the difference in potential between 10 physical electrodes placed on the surface of the body. The term 12 leads of the ECG is for 12th number of recording made from the pair of these electrodes. Dramatic representation of connections or directions next axis of each lead in a 12 lead electrogram. ECG leads are divided into two groups: 6 limb leads, extremity leads, and 6 chest leads, precordial leads. The limb leads record potential transmitted onto the frontal plane, and the chest leads record the potential transmitted onto the horizontal plane. Reading 12 leads ECG. The best way to read 12 leads ECG is to develop a step-by-step approach. Step 1. Determining the heart rate. The ECG is normally recorded at a speed of 25 mm per second. Each small square in the graph is 1 mm and represents 0.04 seconds, and big box with heavier lines represents 0.20 seconds to 100 milliseconds. Rule of 300 by 1500. For regular rhythms, count the number of big boxes between the two QRS complexes and divide this into 300. The heart rate beat per minute can also be computed readily from the interbeat R, number of small units into 1500. 6-second rule for irregular rhythms. ECG records 6 seconds of rhythm per page. Count the number of beats present on the ECG, multiply by 10. Variation of heart rates and its causes are listed. Normal is 60 to 99 beats per minute. Bradycardia is less than 60 and tachycardia is greater than 100. Bradycardia causes are hypothermia, increased vagal tone, athletes, hypothyroidism, beta blockage, marked intracranial hypertension, obstructive jaundice, uremia, SA node disease, ischemia. Any cause of adrenergic stimulation, thyrotoxicosis, hypovolemia, vagolytic drugs, anemia, pregnancy, vasodilator drugs, hypertensive agents, fever, myocarditis. Step to determine regularity. Look at the RR distance. Regular, occasionally irregular, regularly irregular, irregularly irregular atrial fibrillation. Determine the axis. Normal QRS axis from minus 30 degree to plus 110. Minus 30 to minus 90 is referred to as left axis deviation. Plus 110 degree to plus 180 degree is referred to as right axis deviation, and minus 180 degree to minus 90 degree is referred as north-west axis extreme axis. In no man land indeterminate axis. Sinus rhythm. Cardiac impulse originates from the sinus node. Every QRS must be sinus node. Every QRS must be preceded by a P wave. Sinus tachycardia rate greater than 100 beats per minute, otherwise normal. Sinus bradycardia rhythm originates in the sinus node, rate of less than 60 beats per minute. Sinus pause. In disease 6 sinus syndrome, the SA node can fail in its pacing function. If failure is brief and recovery is prompt, the result is only a missed beat. If the recovery is delayed and no other focus assumes pacing function, cardiac arrest follows. Atrial fibrillation, atrial flutter, ventricular fibrillation, ventricular tachycardia, torsades de pointis, supraventricular tachycardia, atrial premature beat, premature ventricular complexes, atrial pacemaker, artificial pacemaker. Check the individual waves, calculate intervals, QRS complex, Q wave, ST segment, T wave, QT interval, U wave, assess for hypertrophy, Romhild's estate point score system, common causes of left ventricular hypertrophy, ischemic heart disease.